Hello and welcome to Art from Heart Beyond the Canvas. I'm your host, Avni Shiram, the founder of Art from Heart, and today we'll be diving into the world of art and healthcare. We're thrilled to have Dr. Ida Sim as our guest. Dr. Sim, MD PhD, is a professor of medicine and computational precision health at UCSF and UC Berkeley and co director of the UCSF UC Berkeley Joint Program in Computational Precision Health. She was UCSF's first Chief Research Informatics Officer and earned her BSMD and PhD in Medical Informatics from Stanford. A practicing primary care physician, she completed her training at Massachusetts General Hospital and the Palo Alto VA. Her research focuses on large-scale scientific computing and health data sharing. She co-leads Jupiter Health and co-founded Open M Health and Vivly, the world's largest data sharing platform for participant-level clinical trial data. Dr. Sim is a member of the National Academy of Medicine and a recipient of the Presidential Early Career Award for Scientists and Engineers. Thank you for joining us today, Dr. Sim. We're excited to have you as our guest and share your journey with our audience.
Thank you for inviting me.
Of course. So, first off, I would just like to ask you what initially inspired you to pursue your field?
Well, first, there's the question of what is my field. I have many different fields, I feel. There's primary care, internal medicine, of course, just the practice of medicine. There's the intersection of computing and medicine. But there's also the interest in how we think about the thinking in medicine. And that's actually what originally drew me to this field. I was in med school and I noticed that there's some students who seem to just get it. They get on the wards and they're just right in the slip of things. They kind of know what to ask and they kind of know how to enter into the discussions and diagnosis. They seem to get it, and some students really have a harder time. And I was really curious what it was about how we think as physicians and why it comes seemingly more natural to some than the others. And I thought, if we could use computers to figure out how we think about diagnosis and treatment in clinical care, maybe we could do a better job of teaching it. And that's kind of what originally got me into sort of the AI computing and medicine thing.
Wow, that's really awesome. So, would you say that your work has changed a lot like recently because of how AI is changing too?
It absolutely has, but in ways that are really surprising and exciting, but the fundamental questions are still the same, which is how do we know truth? How do we know something? And what is it that we need to know? Is it just, uh, facts about the world, or is it how people feel? Is it how do we make decisions? Is it just, again, factual knowledge? Is it preferences? Is it optimizing clinical outcomes, or is it optimizing how people feel and their agency in their care? So I think those are the same questions. AI gives us more powerful tools, but it also changes who's asking the questions and who is doing the quote unquote thinking and who's doing the decision making. So yes, and it's all the same and also completely different.
Hmm. Wow, that's very interesting. I mean, I feel like what you're mentioning is kind of like a bias that different people might have, like in healthcare and how that might impact like how they approach treatment or diagnosis or something. So,
Absolutely, and that hasn't changed, right?
yeah,
Yeah.
yeah, that's very interesting. Awesome. So, where do you draw inspiration from to stay creative, and how do you think creativity connects with all the work that you do?
Yeah, when I first got this invitation, it was I think what do you call it, art from heart, and it's like, but I don't do art. Like, my daughter does art, but I don't do art. But no, it's creativity, right? And there's
Yeah.
intellectual creativity, and science is, if anything, it is actually really, really creative. Medicine itself is a type of creativity. Uh, how you engage with your patients is a form of creativity. My work intersects with a lot of different areas. There's policy, there's computation, there's math and statistics,
Mm.
there's public health, like it goes on and on. I read very widely. I have always liked everything. So I love reading history, I love reading philosophy, politics, basically anything.
Mm.
So I think that's where I get my new connections from, and just seeing things from different perspectives. That's what keeps me creative, I think.
Wow, that's very cool. So, would you say that, like the different kinds of like reading, how does that like impact how you approach like healthcare? Like, are there any translations that way?
Yeah, so this morning I was reading an article about the philosophy of science, and
Mm.
how the epistemology of probabilistic thinking versus more statistical thinking reflects in how we explain risk to individual patients.
Mm.
And not going to go into it now, but that's something that I've actually been reflecting on for many years. And I think that there's a very subtle difference there in saying your risk of cancer is X versus on a population basis, people like you have a 40% risk of cancer. Those are actually
Mm.
two very subtly, very, very different things. Um, and with AI now, there's just this assumption, there's really an unquestioned thinking about, oh, you get a bunch of data together in your electronic health record, and I build a model and I predict, right? It's predictive analytics, and boom, there you go. And now you can have decision support. But there's a philosophical contradiction in there that's been studied for many, 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 many years. It goes back to Aristotle. And yet, if you don't think about it, it seems really obvious. It's like, yeah, you just take data and you predict it, and bingo, we should, that's what we should do. And that's not the case. That's not the case when you're applying it to real people and real decision making. So
Mm.
that's an example of how, a lot of sort of very broad reading, comes to, have some very, very direct implications if we choose the time to think about it.
Mm, that's very interesting. And I feel like then you'd also have to consider like the ethical implications of using like artificial intelligence,
Oh yeah.
either like aiding doctors and like healthcare professionals or like replacing them. Like that's like probably a big thing that's
It's
being
a
discussed
huge
right now.
thing. It's a huge thing.
Yeah.
So it's a very interesting time to be doing basically anything.
Yeah. Yeah, AI is very interesting and yeah. Awesome. So this next question is pretty fun, but can you share a memorable or challenging moment in your journey and what you learned from it?
Yeah, I think when people hear about my journey up to now, there's this notion that there was just this linear thing, and that you did this and then you did that, and whoa, look where you ended up. And it's just not at all like that. I used to think that when I saw people up on the stage, like, oh my God, like, how did they like get there? How did they do all those things? And I'll never, ever, oh my God, like never, never get there, right? And of course, that's not how it happened. So, my dissertation was this crazy idea that if you report on a clinical trial, which is like experiments that prove that drugs work and so forth, that if you were to publish it, you should also publish your data and your trial as a computable thing
Mm.
along with your journal paper, because then people can do science on it right away.
Mm.
And this was back in whatever it was, the 90s. And, it was a crazy idea. I got a bunch of grants on it. I slogged on that idea. And about 10 years after that, it was going nowhere. Really, it was absolutely going nowhere. My grants weren't being funded. People were saying, what are you trying to do? I had editors of major journals saying things like, well, you're just trying to destroy us. And it's like, not really. This is before electronic publication, so like that whole thing, it just died. It just died. So I pivoted to something else. I pivoted to mobile health, digital health. And lo and behold, the idea came back up, long story, but 20 years, almost to the month after I finished my dissertation, I started Vivly, which is a nonprofit. that actually does data sharing of clinical trials.
Mm.
And now it's the world's largest clinical trial data sharing platform. There were a lot of political and commercial and scientific reasons why it happened, and it was the right time to start a nonprofit. I never thought I would start a nonprofit. Um, but yeah, so my dissertation is alive and well, not in any form that I thought it would be. And the lesson there would be, don't give up on your crazy ideas, but be ready to move on. They don't don't hang on to them, to the death, right? Be ready to
Mm.
move on, but also be ready to come back to an idea and also be willing to um, allow the idea to morph. I think,
Mm.
earlier on it was like, this is my idea, and I want to see the idea come to fruition the way that I had it. And it just wasn't going to happen. And when it came back, like 18, 19 years after, it was a different form of the idea. It was still somewhat the same idea, but it was different. And it took a little bit of just saying, that's close enough. It's close enough. Dive right in. So that's what I would take the lesson away from.
Mm, that's very interesting. Yeah, and I mean, I guess like being flexible is important because as like years go on, then like situations change and
Right.
there are different priorities now or
Exactly.
like
Yeah.
all of that also is kind of a factor. So, yeah, but that's awesome that you're still able to continue that. So, that's great. Awesome. Now I wanted to ask you if you could collaborate with anyone, who would it be and why? And what kind of project would you do?
I think some of the biggest opportunities in health AI right now is for generative AI and other forms of AI, along with digital
Mm.
health, to help people. And I say people very deliberately, not patients. Patients are us as people who are sick, right? Our role as patients is to be sick and need care from healthcare, okay? But of course, as individual people outside of our role as patients, we also want to maintain our health. And frankly, for uh, the 70% of Americans who have at least one chronic disease, we're the ones who are managing our disease ourselves. It's not, I'm a primary care doc, right? I'm not the one managing your diabetes. You are. Like, let's just be really clear about that. But we don't really help people to manage their own health and their own diseases, their own conditions. I
Mm.
think the biggest opportunity is people out there where maybe they don't even have access to a doctor. Maybe they don't have health insurance. Maybe they're just too far of a drive away. Um, so I think there's a tremendous opportunity to meet people where they are and to build health and healthcare out where the people are. So I'm working on, collaborating more with patients outside of the healthcare system. What does that look like? And making sure that whatever that looks like is seamlessly tied into what we do in healthcare. So I think that's a huge, huge frontier and opportunity.
Wow, yeah. I mean, that's like like a crazy statistic. Like 70% of Americans have like some sort of a chronic illness, and I feel like there are like di probably different barriers to getting care, like financial barriers or like
Yeah.
the things you mentioned. So, that's a great initiative. And like is there anyone in mind that you might like pursue this like project
Yeah, no,
with?
it have there are patient they're sort of professional patients, and they're patient researchers, and they're patient
Mm.
advocacy groups. As part of Vivly and clinical trial data sharing.
Mm.
Obviously patients are part of that conversation as well. There are, growing numbers of patients who are in the health AI space. That's really evolving. And yeah, I know a few of them, and we're have some crazy plans growing. So yeah.
That's awesome. Yeah. Great. So, I know we've been talking a lot about like how healthcare and AI are sort of like changing, and I feel like that's also changing how maybe like the youth are also going to approach like these fields and like what kinds of things we'll be doing. So,
Mhm.
What advice would you offer to young people who are pursuing creative or professional passions?
Yeah, it's that word passions, you know. So I would say the take home is don't focus on your passion. Passion comes second, third, fourth. It doesn't come first.
Mm,
That's my main message. Focus on a problem or an internal need or interest that you might have, and then just work at it, just chip at it, apply
mm,
yourself to it. Do it with intention, do it with integrity, do it pragmatically, just get going on it. Not because it's a passion, but because there's something there. There's something there that either you're driven or there's something intriguing about it.
mm,
See where it goes. See where it goes. It may well go nowhere, but that's okay because in that process, you will find something else where you will go into. So your energy will naturally channel to another direction. And I think the deepest quote unquote passions come out of that
mm,
eventually out of that exploration and that work and engagement where you're not looking for the passion, you're just looking for that engagement and um, that deep understanding of something, then I think you'll find a deeper and truer passion, and then your meaning will come from that. So don't I know you're supposed to identify your passion. It goes in your college essay. I think that's a really hard way to go about life. Really
yeah.
hard way. Yeah,
No,
yeah.
yeah, thank you for sharing that because I mean, as high schoolers, we're also not sure what path to take because I feel like we feel like we're just going to be locked into that one thing, but I
No,
think
no, no. It's
yeah, I mean, there's like so much time to explore and I mean, I'm also interested in going into healthcare. So, and obviously, I don't know what I want to like specialize in or what kind of a doctor I want to be or if I want to do more research or something, but so yeah, I mean, I'm that's great. Like I should just keep an open mind and
just keep an open mind, be excited, be curious,
yeah.
keep working on it. Who knows what medicine will be like 3, 5 years from now, let alone
Yeah.
when you're done with med school. So, things are going to change. So don't force the passion. I think, even if the college process seems to require you to do that, I have my thoughts about that whole process.
Mm,
But don't, if you have to be performative about your passion, at least in your heart of hearts, don't hold yourself to some giant passion project because that's not what life is about.
mm. Yeah, awesome. Yeah, thank you for sharing that.
Okay.
Well, yeah, thank you so much, Dr. Sim, for sharing your incredible journey and your insights with us today. And it's really been a pleasure hearing about your experiences and the passion that you bring to your work in medicine. So I'm sure that all our listeners have gained a lot of valuable inspiration from your story.
Thank you for having me. It was
Of
fun.
course. Yeah. And to everyone tuning in, thank you for joining us on this episode of Art from Heart Beyond the Canvas. We hope you enjoyed this conversation as much as we did. Be sure to subscribe and stay connected for more exciting episodes exploring the intersection of art and creativity in all its forms. Until next time, stay creative.
Wonderful. Thanks.